Dr. Russ White, and I'm a cardiothoracic surgeon and the director of the new Cardiothoracic Center here at Tenwek Hospital. I first came to Tenwek in 1992 and saw that initially there was a really big problem with cancer of the esophagus, which is the most common cancer among men in Kenya and the third most common cancer among women. And basically nothing was being done for these patients. That was a death sentence. And you could get a feeding tube in your abdomen and that was it. So I thought we can do better than that, and I was in training at the time. I went back and finished my training in general surgery and then proceeded to cardiothoracic training, specifically to work with esophageal cancer. The esophagus is in your chest, and thoracic surgeons operate on those. I never expected we would do heart surgery at Tenwek. I thought it was too expensive, required too much tech, and I didn't think there were that many patients that really needed that. I was wrong about that. So for the next 12 years or so, we focused on esophageal cancer, and then it started to become clear to me that there were more patients waiting for heart surgery. And once we started doing a case or two, patients came from all over, and it was clear that there are thousands of people waiting for open heart surgery. Right now at Tenwek, we have a list of about 850 people on a waiting list who need open heart surgery. Every week, somebody on that list dies waiting for surgery, and we have been limited to one operating room in the main hospital. And you can only do so much out of one operating room. So about 7 years ago, we developed a vision. We said, why not build a separate, dedicated cardiothoracic unit where we could increase our volume and take care of more patients. What you're standing in today is the result of that vision that started and carried through. So we now have this facility, which is 400,000 square feet. It houses 7 operating theaters and a cardiac cath lab, full endoscopy suites. So we are capable to take care of everything cardiothoracic. And that's kind of a different name for some people. It means anything in the chest. So from here to here, there's a lot of important things there: your heart, your esophagus, your lungs, and we take care of any of those things at any point. And even in our work in the one main operating room, we are performing more open heart surgery than any institution in the country of Kenya. So as we open this facility, we expect the volume to go up significantly. We began with constructing some apartments because we also teach people to be cardiothoracic surgeons, and perfusionists, which is the group of people that runs the heart-lung machine during open heart surgery, and critical care nurses. And we needed to house our trainees somewhere, so we built that first. Then we built a water treatment plant and a sewage treatment plant because the current facilities wouldn't handle this facility. So we did all that before we ever started building this. We partnered with a number of different groups, and one group in particular, Samaritan's Purse, which is a United States-based relief and outreach organization, partnered with us and helped us financially to get where we are today. At the main hospital, we employ about 1,300 people. Those salaries have to come from somewhere. We anticipate opening here with 300 employees, but that will expand eventually to probably 1,000. So keeping financially afloat is a trick. It's difficult. With the fact that 70% of our income or so comes from the National Health Insurance Fund, has historically, that becomes a problem in that when we are paid 6 to 18 months after the procedure. Right now, we are owed 480 million shillings by NHIF. which paralyzes us as far as growing and proceeding. As you're well aware, the SHA has just come into being, and we're waiting to see what happens with that. Historically, NHIF would cover about half of the cost of heart surgery. If SHA does what it says it's going to do, it will cover nearly the entire cost of heart surgery. That will open the door for so many people who don't have to raise the other half of what they need to do. So we're waiting and hoping that this new program will help us. We have patients coming from all over Kenya, from Ethiopia, from Congo, from Burundi, Rwanda. They're coming from many different places. We try to keep our costs as low as possible to make it available to people, but we do have to pay a staff. We have to operate.
Well, coming now to the CTC Center, what are the major key milestones you've achieved, maybe from the main hospital, now coming into the new facilities?
I think we will probably very quickly double our volume from down there, because as we open, I mentioned there are 7 operating theaters.
Yes.
Initially we're going to open 2, and then we'll open a 3rd and a 4th as we grow. But I see us probably doubling our volume very quickly within the first few months, depending on the social health insurance, and we'll see how that goes. As far as milestones, we will definitely be the biggest, and I'm quite biased, but I think we'll be the best cardiothoracic center in all of sub-Saharan Africa. When you talk heart surgery, there's a condition called rheumatic heart disease. That's probably the most common thing we see right now. These are children and young adults who suffered a bacterial infection when they were very small, and now it attacks the valves of their heart. We see that all the time, and many of the people are poor, have difficulty paying for the fees. So the other thing we're doing is we are now screening in the schools here in Bomet County. We're screening to find these patients when they have this disease but have no symptoms. If we find them then, we can treat them with medications that will likely avoid surgery for the rest of their lives. So we want to intervene earlier in the process, but we're still going to see hundreds and hundreds and hundreds who need surgery, and that's the only treatment that is going to save their life, and in most cases give them a very long normal life expectancy with a single operation in the young stage of their life. As far as the cancers we see esophageal cancer all the time. I might add that the new social health insurance plan offers no payments whatsoever for diagnostic procedures to diagnose the most common cancer in the country. That's a real problem. We are lobbying and hoping that they will make this open, because I'm sure what we're going to find is many, many people coming very late when they're uncurable, we can't operate, and they simply will die. So that cancer I expect we'll see more and more, because we're not able to diagnose it early unless you pay out of your pocket. And we are, as I say, we're lobbying to get a change in that, and I hope the social health authority will listen to that.
Other than that, is there any internal initiative to maybe make it more affordable within the facility?
Yeah, we're doing a number of things. We're looking at imported equipment that we can achieve at a lower cost. There's so many pieces that go into the hospitalization of a heart patient, and we're trying to look at every single piece, get the best prices we can. You have to understand, like for rheumatic heart disease, most of them require an artificial valve to be put in the chest. That valve alone can cost $2,000 US. So there are some things we just can't come below, but we're trying our best to keep them affordable for all the people. I think we're the only place in the country that's offering minimally invasive heart surgery. We intend to expand upon that. We are opening our cardiac catheterization lab, which will be the only one in Western Kenya. And I did not mention coronary artery disease. Now, this is the type of disease in the West you see in elderly people because the arteries get narrowed. And we always thought it didn't exist much in Africa, but we're finding it does. And we can offer treatment through the cath lab, meaning no surgery, but operating essentially through small little catheters that go up into the heart. And I'm going to save some of what they want to do for my colleagues because they have big plans for where we will go.
Okay. Now, I might take you to the last question I have for you today. How would you see, how would you see this facility contribute to maybe the success of health and lung health care in the region? Yeah.
I see the Cardiothoracic Center at Tenwek Hospital will be the premier teaching center for the entire region. So we'll be teaching surgeons, which we already are, and I would say the best surgeons in the country. We're teaching perfusionists, those who run the heart-lung machine. We're teaching critical care nurses. I suspect we will expand to teach cardiologists. Those are the medical doctors who do the catheterizations and the non-surgical procedures. So I think we will have the largest volume and be the largest training center in the region.